talaga. Lagi na lang nagkaan.
Okay. Han transfererar datorn.
Mr. Lake.
Who are you?
I'm a new SPR. Was she having a baby elephant? I'm looking for Mr. Hurley's firm.
Next floor.
Thank you.
Guiney.
Roger Hurley's new SPR.
Hello, I'm Sister Rix. Roger shouldn't be alone.
Sorry, Donna. You wouldn't happen to be involved with Roger Hurley's gynae list for this afternoon?
I'm his new registrar.
I've been bleeping the SHO for 15 minutes now, and I'm late for theatre. I'd like the diabetic first on the list. Any questions, worries?
Yeah, sorry, one. Who are you?
Maria Orton, anaesthetics consultant. I'm sorry to dump that on you.
When's it due?
Not soon enough. Blood results are in.
New colourway, new decoded.
Shit.
Wobbly, comically.
Oxford Handbook. Can't get by without it.
Morning, Ma.
Good morning, Roger.
Roger Hurley. Welcome to the coalface. Ma, this is our new SPR, Rob
Blake.
Blake.
Hi.
Okay, shall we go? How are you, Donna?
Fine, Roger. You?
Oh, Zach was up half an hour with a cold, so we'll probably all get one now. Tony, Rob, this is Mr. Whitman, our principal consultant.
Now they dish out meaningless titles for every year you go without being suspended. How'd you do it?
Holly Gray, specialist registrar.
Pleased to meet you.
Tony, are you taking on the CA?
Oh, she's got a cervix like a cauliflower. It's not an operation she needs.
It's radiotherapy.
a pine box.
Roger, I'd suppose you'd... Thanks. Advanced CA cervix.
Her MRI suggests that she's borderline operable.
Morning, Mrs. Collyer.
Winifred, hi. My name's Roger Hurley, yet another doctor, I'm afraid. Your scan suggests there's a possibility that surgery could help you. It would be a palliative procedure. It wouldn't cure you, but it would make you much more comfortable. Would you add Mrs. Bourne to my list, please, Donna?
Yeah.
I'll do my best for you, Winifred.
Thanks, Roger.
This is Philip Sterry.
Morning, Mrs. Collier. How are you?
Hi.
As you know, we'll be going in with a small telescope to perform the sterilisation. 6 kids. Oh, we'd better get on before we pop another one out.
Lap and die for theatre today.
Lap and die for investigation of subfertility. Morning, Mrs. Campbell. We're going to have a look inside your abdomen with a small telescope to see if there are any problems that have stopped you from getting pregnant. If we do find something, then hopefully we can treat it and you'll be able to start a family.
Thank you.
Everything okay?
Yeah.
She's a diabetic. The anaesthetist wants her first on the list.
Thank you, Rob. Mike, could you change the list, please, and put Mrs. Collier first, please?
Campbell.
Campbell, yes. Sorry. Slip of the tongue.
Hi, Anne-Marie, it's Maya. We want to move Mrs. Campbell to first on the list.
There you go.
Thanks, Anne-Marie.
No problem.
Thanks. Right. Gillian Campbell, G888 953 8274.
Yep.
Yep. You all right?
Hi, Anna.
Hi, Lydia.
Hi, I'm Dr. Orton. We met in the ward before. I'll be putting you asleep for your operation.
Morning, team.
Morning, boss.
Joy. Morning. Lovely carrot cake. Thank you very much.
Oh, thank you.
So, did you do many sterilizations in your previous post?
Good for you.
Good.
No, it's a lap and die. Gillian Campbell, G8889538274, laparoscopy and die.
You sure?
Yes.
Someone bring me the notes, please. Sterilization. Lap and die for subfertility we saw on the ward round. Rob, you happy?
The list's wrong.
Okay, correct the theatre list, please. Okay, back to work, everyone. Music, please. I do beg your pardon, Maria.
Is that it? This patient's desperate to get pregnant. You came within a whisker of sterilising her.
We'll deal with it later. Ready, Rob?
Mr. Lake, do you know who's responsible for this cock-up?
Sorry, first day.
Scalpel.
Shall I report this as a
I
neonate?
just said we'll deal with this later.
Fine.
Everything okay, Mrs. Campbell?
Fine, thank you.
Good. Is she okay?
Yeah, she's fine.
The theatre list was written up wrong. She was down for a sterilisation.
Marie must have typed it out wrong.
It's your job to check.
Shit happens, sorry.
You been around the other patients yet?
Love to, but 5 o'clock. Got a hot date. Not my problem.
Wonderful.
The area of CIM is excised completely. If we await histology and if there are no surprises, we will operate routinely.
Tony, when you interviewed her, did you bother to ask if she could type?
Yeah, 60 words a minute. Give or take a minute.
Tim Sibley, A&E Senior SHO, Mr. Whitman.
Senior SHO, isn't that an oxymoron?
Under tautology. Senior house officer.
I tried bleeping your SHO, but I got no response.
We don't have an SHO.
She's supposed to be arriving from Spain, but she can't get registered unless she's got a job, and the hospital won't give her a job unless she's registered.
So, what are you doing, Tom?
Tim, I'm clocking you in. This is Winifred Bourne.
Spare me. She's Hurley's.
Well, we are on take today.
Yes, I know we're on take, Polly, but look at her. She's deader than Elvis. I'm not having her peg it under me. Rog, there's a patient of yours, Mrs. Bourne. She's here.
Tony, do you mind?
She's the one with advanced CA cervix that I ducked out of. I'll leave her with you. Is that right?
No, it's not all right. Protocol is you admit her and hand her back to me in the morning.
You're the one who chose to operate on her. She's all yours, mate.
Rob, you okay to close?
Sure, boss, no problem.
Thank you.
How are you getting on with Roger?
Fine, thanks.
Good. Good.
Polly?
Really sorry about this, Mr. Hurley.
That's okay.
Well, chest film shows pulmonary secondaries, possible pneumonia, though it's hard to tell.
Come and fetch me a glass of water, please.
Water.
Please.
Okay.
Thanks. Winifred? Mr. Hurley, do you remember me? Very good. We're going to make you as comfortable as possible, okay? Thank you. Just going to take your mask off. It's okay. It's okay. There you go. Very good. Hold on. I'm just going to put your mask back on. There you go. Okay. Thanks.
The daughter's complaining. They've already been here 8 hours.
When did I operate on her?
October the 1st. Bad luck.
What's the problem?
Post-operative mortality. If she lives for 30 days, she won't appear in the figures.
Tim. Is it Tim?
Yes.
Could you check if there's a hospice bed available, please?
Of course, my pleasure.
Thank you.
Thank you, Mrs.
Doctor, I'm
Yes.
Mr. Bourne's daughter.
Yes, of course. Mr. Hurley. I'll take your body, thanks.
She's pissed herself.
Is that so?
You don't expect me to change the bed, do you?
I wouldn't stop you.
Donna? Offering to play Debbie McGee to my Paul Daniels?
I'm sorry to bother you, Mr. Hurley, but
Mr. Hurley? Uh-oh. What have I done?
I don't think it's appropriate for Mrs. Bourne to be on the ward.
It's just so she can be transferred to the hospice.
Which hospice?
Newlands?
There's 60 patients in this hospital that the bed manager thinks has a place at Newlands. Newlands isn't built yet.
I thought I could get her in somewhere tonight. There wasn't time to sort it out. She'll move out in the morning.
As I said, Roger, I don't think it's appropriate that she's in an acute gynae bed.
Donna, you were the one that wanted me to help her in the first place. I don't think it's fair to share in the credit when things go right, and to blame me when things go wrong.
Boost the driver.
I have done.
Well, boost it again.
Ovarian salvage is the cornerstone of my work. I believe some unilocular ovarian cysts can be managed expectantly. This strategy is appropriate for women with a cyst size of less than 5 centimeters. Cysts 8 centimeters or less have a very low risk of malignancy and often resolve spontaneously. This is the fundamental objective of my work, to give the woman her best chance of a normal reproductive life. Thank you.
Boss, I need to talk to you about this CA cervix one.
What's there to talk about? Get her through the night. Here we go. Good. Need back? Actually, can you just give me a minute? Rob, if you need me to come down, I'll come down.
No, it's fine.
You sure?
Yep.
Sorry about that, Liz. How are you? Next week's fine.
She's already had 24 hours of Diamor.
Give us some more.
Not me.
Give us some more. Or I will.
She shouldn't even have been here.
No, she shouldn't.
She wasn't even that old.
Well, she's dead now. Don't get much older than that.
How is she?
Sorted.
Rob, I'm sorry. These lectures, they don't come up very often. Thanks for covering. This month I had one instance of post-operative mortality. Patient was 67 years old with end-stage CA cervix, pulmonary mets and pneumonia. She was awaiting transfer to hospice, but unfortunately died on the ward before a place could be found. I carried out palliative excision and repair on her 29 days prior to her death. Radiotherapy was an alternative, but it would have made her extremely ill. The palliative surgery gave her the best chance of a reasonable quality of life, and the MRI scan indicated she was operable. Thank you.
Death is a death, though, when it's in black and white.
Yeah, but it's easy to have impressive figures when you turn away anyone who's really sick.
Yeah, someone told me something once. I think it was an old boss of mine. The superior surgeon uses his superior judgment to steer clear of any situation which might test his superior ability.
Oh, we're going to fix this.
Yeah, they haven't so far.
Thanks for everything.
Oh, you're welcome. Thank you. Oh.
Air. Mustard flavour. I'm into mustard this week. The Antichrist wants mustard. Oh. Just wrong. What? Just wrong. Oh, drugs wrong.
I tingle.
It's Rob Lake, you're bleeping me.
Hi, Rob, it's Maya. Look, I know this sounds like rubbish, but I've got a patient here with a really bad sore throat. I was thinking it could be acute epiglottitis. We're ready for you.
She needs an ENT opinion. Look, I've got to go into a case, but if you've got any problems, give me a call, OK? All right, no problem.
All right. OK, Angela, can you keep still for me? I just need to listen to your chest.
It's okay.
It's all right.
Shit. Donna, get me an adrenaline Nebenroids and 200 hydrocortisone IV.
OK.
Did you speak to any at ENT?
I thought you were going to do it.
What?
You said she needed an ENT opinion. They'll only see gynae patients if the registrar above make the referral, so I assumed you were going to call them.
That's not what I meant at all.
That's what it sounded like. Wait, what do we do?
Get the crash trolley. I need the bleep number for the registrar and call for ENT, please. Thank you.
Fine.
O&G, Mr. Lake. She's busy. Listen, mate, I need this line for an urgent medical call. O&G, Mr. Lake. Thanks for getting back to me. OK, I've got a woman with possibly acute epiglottitis.
OK.
Well, get here as soon as you can, please. ENT Reg is non-residential. He's in theatre at General. He's going to get here as soon as he can.
She might last.
Can you put out a fast bleep to the senior anaesthetist on call? Thank you. What's her name?
Angela. Angela, stop.
Angela. The ENT surgeon's going to be here very soon. In the meantime, you've got to let the nebulizer help you breathe. Try and relax for me, OK?
Some oxygen, yeah? Rob, help you breathe.
She's going. She's going.
I need an anaesthetist. Shit.
All right, Angela.
All right, calm down, Angela.
Stay calm. All right. OK, Angela, keep still now, darling. I know.
Hold it down.
It's all right. It's all right. It's all right.
Hold it down. Right, still, please.
Angela, come on, sorry.
There's too much edema. OK, I need a big Venflon and a three-way tap. Get me an oxygen line running, please.
Venflon, three-way tap.
Just do it.
OK, hold her still, hold her still, hold her still.
Please give her a three-way.
I know. I will when I'm ready, thank you. OK, I'm in the trachea. Keep still, and. Oxygen's in.
The oxygen's going in now, Angela.
Angela, the oxygen's going to help you, but you've got to help me by keeping still, please. Keep still. Oh, shit. OK, she's going to need a surgical crike. Get back onto ENT. Call around, see if anybody's done a crike before, and call Mr. Hurley.
She needs it now, Rob.
Never even seen a crike.
She needs a stable crike. You're the closest thing to a surgeon we've got right now.
Still got an output.
Put out a 222 respiratory arrest.
Just do it.
Any news?
Not yet.
Hold it down, all of you. Hold the rock fucking steady.
Trying.
Oh, she's bleeding into her trachea. I haven't got a clue what I'm doing here. I don't know what I'm doing. I haven't got a clue. I haven't got a clue.
Too late, mate. She's gone.
Very well.
Get me another tube.
Rob. Rob, listen up. Thanks, everyone. Okay. Sit down. The ENT had an emergency of their own. If they hadn't, they'd have been here. But even then, there's no guarantee she would have survived.
I had a chance to do a crike and I botched it.
Look, we're not machines, Rob. We can all have an off day. You made an isolated, uncharacteristic error.
I panicked, I let everything get on top of me. I shouldn't have...
You're not expected to be able to perform a surgical cricothyrotomy. The only mistake you made was taking it on. Some doctors don't take on the difficult cases because they're afraid of failing. Now, that's not how we do things on my firm. We're not obsessed with buffing our figures. We do what's best for the patient. And if you hadn't have acted, that woman would have died.
She did die.
Rob, I consider this a tragic accident. An accident's where no one's to blame. You're not to blame.
You all right? Good. I'd just like to take a seat in here.
Thank you.
I'll tell him you're here. Yeah, hello, Anne-Marie. It's Donna. Would you let Mr. Hurley know that Mrs. Strawberry's daughter and son are in the gynae ward office? Yeah. OK, thanks.
Mr. Hurley's secretary says he's already on his way up, OK?
Morning. I was one of the doctors dealing with your mother. She develops a condition called acute epiglottitis, which causes the throat to close off. We have to make a hole in the throat to enable her to breathe again. For a specialist in throat surgery, this is a relatively simple procedure. However, it's not something we really do on this ward. Hysterectomies and caesarean sections are our thing. A specialist was required a very short amount of time and...
Morning, Rob. Hi, I'm Roger Hurley. I'm the consultant. Very sorry for your loss. Rob, could you do me a favour and start the ward round? I'll catch up with you. Thank you. Your mother was under my care following her hysterectomy. Surgery puts an enormous strain on the body. I think she was susceptible to infection. And what started out as no more than a simple sore throat turned very quickly and very alarmingly into a life-threatening condition. The doctors here only had what amounted to a minute, or less, to carry out a very difficult procedure. They did everything they could, but there wasn't sufficient time. We're all very sorry.
A tracheotomy, was that the procedure?
Something similar, yeah.
I've seen it done on television. They make a cut and bingo.
Well, that's television. I'm really very sorry for your loss. If there's anything I can do...
Thank you.
Look, I hate to do this, but I have a ward round to do now. Bye. Come on, we're fine.
Rob Lake.
Here is the registrar for you, Hazel.
Thanks, Doctor.
Everything okay?
Late decelerations. Big dips.
Big dips. OK, the tray suggests the baby might be in some kind of distress. I'm gonna have to do an internal examination.
I just did one. She's fully dilated.
Please don't take this the wrong way, Hazel. I just want to check for myself. Sorry. Okay, she's fully dilated and OT.
Do you want to do an instrumental delivery? We're talking about helping the baby out with forceps.
Let's get her down to theatre. If the forceps don't work, then we'll move on to a caesarean.
OK.
OK? Good.
Hiya, Dottie. Hello. I thought we were doing a CS.
We are.
So, where is the patient?
Hazel, where's my pet?
Doing really well.
So we'll give her a few more minutes. Don't mind you, Rob. Just take a fecal blood sample. Just gonna make a tiny little nick in the baby's scalp, okay? Cute. Big push now. Here we go again. Big push. Good girl.
Push for us.
Good girl. Big push. Good girl.
Still got big dips here, boss.
I know. Let's wait for the fetal pH, yeah?
Our theatre all prepped.
I know.
pH 7.1.
7.1, okay. We're going to have to get your baby out straight away, okay? Have her through, please. Fundal pressure?
Are you okay?
This baby's as flat as a pancake.
Let's just cut the cord, shall we?
May I? Maybe we shouldn't have waited, boss.
Just concentrate on this, Rob.
Go.
Just going to give you an injection.
Suction. Suction.
Retract it, please.
There he goes.
Well done. All's well that ends well. You notice?
You've been Roger's registrar for... how long is it now? Surely you must have cause for concern.
He's just delivered a healthy baby from a healthy mum.
Rob. Rob. He was appointed based on his research in ovarian disease. That and the funding that he brings to the hospital. He isn't experienced enough in general obstetric practice to hold the post of consultant in O&G.
You ever made a mistake? Ever killed someone?
I've been a doctor for 13 years. Of course I have.
Well, then, with all due respect, who are you to point the finger?
Rob, I'm not being insensitive to the cricothyrotomy. Every doctor makes mistakes. But everybody in this hospital knows that Roger makes mistakes again and again and again. Now, that is not an isolated, uncharacteristic error. You know, if there's a willingness to accept that or to learn from it or...
You're wrong about him. He's a supportive boss. He's hard-working. He's a good guy.
Roger Hurley may be a good guy. He's just not that good a doctor.
Yvonne. You're going to be okay. Cat. Oh, God. Bloody hell. Hey, what's the difference between a midwife and a sperm?
I don't know. The sperm can find the cervix.
2 centimetres dilated. You've a long way to go, my girl. A long, long way.
Mrs. Kerr should have her blood pressure checked hourly overnight.
OK, I'll make sure the night staff know.
That's about me done for the day. You?
Another hour or so, maybe.
Long day.
Long day.
I could wait around if an hour if you fancied going out for a quick drink.
Sorry.
Another night then? Next time I won't try talking to you on the ward. I do need to talk to you, though.
Rob.
Do you think Roger Hurley's incompetent?
He's very into his research. He's genuinely caring about his patients.
Have you ever seen him make mistakes?
The maternity unit sees 4,000 labours a year. Some are bound to go wrong.
Days go wrong more often than they should.
Some people say they do.
Who are some people?
Hospital people.
What do you say?
I've been here long enough to know it's best never to say anything.
Morning. Morning.
Oh, I want it out.
He'll make his appearance when he's good and ready. Delivery room 1.
Okay, breathe. Relax. Oh, piss off.
It's all right, love. Breathe.
Would you piss off at all? Mark, I can't stand. Oh, the baby, Mark. Jesus. Oh.
Sorry about the wait. I'm Dr. Dutton.
She's 28 weeks pregnant. Will you need to deliver it early?
I'll examine your wife and, well, then we'll see.
Thanks. Tell me when you feel the next contraction coming.
Shit, you tell me. Midwives. Christ, you all think you're so...
I'm Mr. Lake, a registrar. I'll look after you, OK? Signals.
Trying. Don't you dare break it.
OK, good. There's a heartbeat, a strong one. I've spoken to the consultant. We're going to get you in 30. You're going to be
I've got Roger
fine.
on the phone.
Thank you. Boss, 28-weeker probable abruption.
What do you want?
Shit. Boss?
One chicken
Hiya,
chili, one sweet
patient
salad,
Karen Taylor,
one
39 years old, 28 weeks gestation. Probable abruption. She's bleeding heavily. BP 100/60.
Okay, well, I'll finish off with DNC and then come up and join me straight away.
Thanks, boss.
Is he okay?
He's fine.
She's all yours, thank you.
Doctor.
Sorry.
Swab.
Shit, she's bleeding faster than we can put her bags.
Trying.
You should have done a hysterectomy.
Don't tell me what to do. I'm in charge here. Swab.
She's crashing. Stand clear. Stand clear. Head, feet, body, myself, clear. Charging at 200. Shocking. No output. Stand clear. Charging at 200. Shocking. No output. Stand clear. Charging at 360. Shocking. Start compressions and adrenaline.
2, 3, 4, 5. 1, 2, 3, 4.
I can't control the bleeding.
1, 2, 3, 4, 5.
Start compressions.
I was trying to save her womb.
No output. Stand clear. Charging at 360, shocking. Sinus tachy.
The incision's extended into the venous plexus, the broad ligament.
OK.
Her heart is.
Swab.
Let's forget about the uterus, boss. Let's save this woman's life, boss, yeah? Hysterectomy, yeah? Hysterectomy, boss. Armitage. Get me Abdul tray, please.
Abdul tray, please.
I don't know why she bled so much. She just bled.
Mr. Taylor, I'm sorry, I've got some bad news. Your baby didn't survive. I'm sorry.
Mark, I'm afraid Karen suffered some complications during the operation. Her heart stopped beating for a time until we got it going again. Her brain received less oxygen than normal. I'm afraid she didn't come round from the anaesthetic as we'd expect. She's in a coma. There are signs of brain damage. It may be minor. She may make a full recovery. But we can't be certain until she comes round from the coma. If she comes round from the coma. I'm very sorry.
It's okay, I'll take it. Can you get me a camera, please? You can hold him if you like. He's a boy. Would you like to hold him?
We can take a lock, thank you. We can take a lock of his hair and prints of his hands and feet.
He's gorgeous. Absolutely gorgeous.
Something went wrong, didn't it? In the operation.
Sometimes things go wrong.
Did somebody make a mistake? What's the point of asking you? You all stick together. Excuse me. What's happening?
The body's still producing breast milk. I can prescribe her with a tablet to suppress lactation if she comes around. It might be easier for her. She's stable. Hopefully she'll recover consciousness in the next 24 hours. Did you have a name in mind if it was a boy?
Daniel.
Would you like him to be named? Would Karen like that?
Yeah, I think so.
morning. Mr. Taylor. How are things?
How do you think?
Mr. Taylor, would you allow me to explain what happened? Your son was only 28 weeks gestation. His strength was compromised both by prematurity and the ruptured placenta, which caused your wife's bleeding. Karen's hemorrhage was severe. She bled so much that during the operation, she suffered a cardiac arrest. And for a short time, until we could revive her, her brain was starved of oxygen. I'll leave you with your wife, Mr. Taylor. If at any point you'd like to speak to me, please ask the nurses to contact my secretary.
Excuse me. He's the reason she's like this, isn't he? I want something done about him. Who do I talk to?
Well, you can complain to the hospital. You can complain to the General Medical Council. First, you should speak to a solicitor.
Well, that's it. He just gets to carry on working.
It isn't my place to comment.
What did he say?
He's angry. He's upset. He wants to talk to a solicitor.
Who suggested that?
He came up. I advised him to think about it. Boss, I don't know what I'm supposed to tell him. I can't keep covering. Well, not covering.
Let me remind you of something, Rob. Not wishing to appear callous. A patient of mine, Mrs. Angela Strawberry, developed acute epiglottitis. You performed a cricothyrotomy. She died. I spoke to the family for you. I told them it was a tragic accident in which no one was at fault, and that's what they went away believing. I covered for you. Look, Rob, let's not fall out over this. If he wants to, I'll talk to him. If not, I'll try again. But no one needs to cover for anyone, because no one's to blame. Sharing the same goals helps us achieve those goals.
Very good. Right. Remembering there's no I in team, can we do the trust exercise, please? Can you get into 4 rows of 2, facing the same way? Dr. Orton? Thank you. OK.
For God's sake.
Here we go. Karen, if you can hear me, blink twice, please. I'm going to ask you some questions. If the answer is yes, blink twice. If it's no, blink once. Do you understand? My name's Maria Orton. I'm an anaesthetics consultant. We're going to switch off the ventilator, the machine that's controlling your breathing, okay? We're switching it off now. It's good she's gagging because the sedatives are wearing off. Karen, I'm going to remove the tube from your throat, okay? It's perfectly normal to be frightened.
I'll pull it out very gently. Be a kind of funniness. No pain. And then you'll be breathing normally again, okay?
Mr. Taylor, this is perfectly routine. Syringe. Karen, I have very bad news for you. Your baby was delivered by cesarean section. But I'm very sorry. He didn't survive.
I've got a photo of him here. Isn't he a beautiful little boy? Called him Daniel, like we said. Here's some prints of his hands, his feet.
I wish this case was the first. It isn't. I've compiled case studies of Hurley's negligent acts since his appointment. I intend to present it to the management. I'd like you to add your testimony.
I've just joined the rotation. He's my boss.
You write a letter. You set down the account of the Taylor case. You give it to me. I add it to my letter. And I send it to the O&G unit administrator.
You're asking me to blow the whistle?
Yeah.
No, I won't blow the whistle.
Oh, come off it, Rob. This isn't
Look,
school.
you don't go running to the management. Doctors deal with doctors.
Is that what you think?
There's the National Clinical Assessment Authority. They can assess him and retrain him. It'll be out of our hands.
And what would prompt the management to refer to the NCAA? A little bird tells them to.
No, but I'm telling you, I'm not prepared to...
Come off it, Rob. No one has lifted a finger about this. None of your predecessors, none of the other anaesthetists, none of his fellow
wait
consultants.
a second, you come off it. You're asking me to write a letter and put my name to it.
We can't let this go on any longer.
We?
Fine. If you can ignore this case.
I'm not ignoring it,
If
Mary.
you can ignore this case, it won't be much longer till there's another one.
If this has been going on so long, how come you've done nothing about it till now?
Mr. Whitman and Mr. Hurley, secretary. I'll get the notes and call you back.
Is that to go today, Maria? I'll run it round for you if you like.
Would you, Marie? Thank you.
No problem.
Hi, Dora. How are you?
Fine. How are you?
Good, thanks. Do you have a few minutes, please? I'd like to see the Taylors.
And again?
I'll just come and see you before my ward round.
We could go somewhere to talk.
Here's fine.
Excuse me.
Certainly, thank you.
It's nicer being on the ward. The ITU can be a bit impersonal. I'm deeply sorry about the loss of your baby. And I'm deeply sorry about your condition, Karen. Let me tell you more about what happened. Karen, you had an abruption. The placenta had come away from the wall of the womb, and there was a life-threatening hemorrhage. Your baby was only 28 weeks. His life was also in grave danger. At that point, I decided not to choose between them, not to work to save one at the expense of the other. I tried to save you both. I delivered your son by cesarean section. He was extremely premature and weakened by the problem with the placenta. We did everything we could to revive him, but he was dead. I'm very sorry. At that point, Karen was still bleeding heavily. I could have performed a hysterectomy. I could have taken out her womb, but this was your first child, and I tried to give you the chance of having another. Was I wrong? Mr. Taylor? If I had taken the womb straight away, your wife might not be in her present condition, but I chose to give you the chance to still be parents one day. She bled. She just bled and bled. I don't know why. And I had to take the womb. I'm really very sorry. I'm sorry for everything.
Are you all right, Roger?
Perinatal mortality runs at 1 in 75. On a unit this size, that's what, 50 odd a year? 1 a week.
Accidents happen.
Yeah. But give me a call if they need anything else.
Yeah, will do.
Thanks.
Okay.
Bye.
Zach splashing in the bath? Oh, you used to splash the water when you were a baby. Yes, you did. You being a good boy for Mummy. Tobes, Daddy's got to go now. Bye. I love you. Bye.
Mr. Hurley, we'd like to talk to you about a serious matter. There's been some complaints about you from Dr. Orton.
Rob, I'm going to ask you a straightforward question. And I'd like a straightforward answer, if you wouldn't mind. What do you know about Maria Orton's allegations against me?
Nothing.
Good.
What's going on?
It's bad enough we have pen pushers spying on our every move. Now it's an anaesthetist.
I'm so sorry.
That's all right.
Excuse me.
Okay.
Am I losing my marbles? Am I not supposed to be gassing for you guys today?
Not us.
Are you sure?
Yep. Bang & Olufsen. I like those, they're good. They're very good. The sort of stuff I listen to, you need a big fruity back end.
Why has my name been removed from the rota?
None of the surgeons are prepared to work with you.
That's preposterous.
Ask them.
The other anaesthetists will be up in arms about this.
Well, I don't seem to be. I think they feel as betrayed by your allegations as I do. As all the consultants do. Maria, if you had a problem with my methods, then you should have discussed them with me.
I tried. Over and over again.
Why are you doing this? Why are you conducting a witch hunt against me?
Dr. Orton, would you like to come with us, please?
Maria, no one regrets this more than me that this couldn't be dealt with doctor to doctor.
Hi, this is Mr. Lake and Guiney. I can't get an answer to Dr. Orton's bleep. Can you check the number for me, please? Orton. O-R-T-O-N. That's impossible. Why would she not be listed? Can you put me through to a secretary, then? Well, she had one yesterday. Is there anyone that can help me?
She's definitely a PP, so can you make sure that her notes get over to my secretary at the Nuffield by tomorrow lunchtime at the latest? Okay.
This week's OPD letters, one's a DNA, the fourth. I don't want to lose to follow-up. I'll have to do a quick GP letter. Can I use a dictaphone, please?
Use your finger like everybody. Oh, okay.
Mr. Whitman, sorry, is this a bad time?
Yep.
Can we talk later?
Well, I'm a little bit busy later. What do you want, Mum?
It's kind of delicate.
Well, all my staff are sworn to secrecy, I can assure you.
Maybe we could go outside the hospital premises. There's a pub around the corner.
I'm on call.
I'll buy you a Coke.
You're on call and you go to the pub. It really doesn't matter what you drink, Rob. Doesn't alter the fact that you're a doctor who goes to the pub while he's on call.
Mr. Whitman, sorry. What's happened to Maria Orton?
Silly cow. So, Hurley makes a few mistakes. What's he got to do there?
You've known all along. You just said Hurley makes mistakes.
Aren't you gonna get that?
Not my job.
I could make your job much more difficult.
How would I tell the difference?
You would know.
They've suspended her, haven't they?
Mm-hmm.
What do we do?
Nothing. Do nothing. Say nothing.
What grounds could they suspend her?
They probably haven't decided yet.
Thanks for waiting, Rob. Right, let's whiz round, shall we?
Tim, are you...
Pass, please. Thank you.
Tim,
Can I have a quick word, please?
excuse me. Dr. Sibley called me down to see the patient.
Yeah, just through there.
Hello, I'm Polly Gray. I'm the registrar. I think she's got an ectopic.
Oh, my.
What?
You're going to want to admit her, aren't you?
Ever so slightly.
Well, we've been commanded to get the patients out of the department, but we haven't got any beds to put them in. Come with me.
Let's keep good too, thank you.
Knackers their figures to have patients stacked up on trolleys. So can your woman wait here?
From the corridor?
Well, it may look like a corridor, but it's actually been designated an observation area. As long as we screw the wheels off your patient's trolley.
The wheels?
Yeah, without the wheels, it's a bed. Unless you can get by with a chair.
A chair?
Hospital guidelines stipulate that a chair is the equivalent of a bed.
Okay, I want her on a trolley, with or without wheels, right here with those doors open, ops every 5 minutes.
Okay.
I'll send for her as soon as I can book a theatre.
Shit, bit of a mess in here, huh?
We've had to bring the topic to theatre. I don't think we're going to make it to the routine lists.
What am I supposed to tell the patients?
Tell them to try acupuncture?
Yak, yak, yak. Polly, less gabbing, bit more stabbing. You're gonna have to open her up in a fine.
Sorry, Kat.
That's 4 PCIs we've had clocked in. Bloods, ECGs and X-rays done, kept nil by mouth overnight. They are pissed off. I'm pissed off. It really pisses me off, Don.
Dear Dr. Sarawagi, thank you for referring this lady who has a 3-month history.
Any more
of
cancelled up?
cause of bleeding.
2 more.
Clinical examination was normal.
You know your waiting list, Tony?
Oh, shit.
This one's been on it 12 months already. When are you going to get her in?
Find out when she's going on holiday.
Tony,
Oh, shit.
the unit administrator wants to talk to you about this month's cancellations.
I don't want to talk to her.
Shall I call her and say can't make the meeting?
When's the meeting?
No.
Well, why didn't you tell me earlier?
You were busy earlier.
Shit.
I've been looking through the cancellations, and yours seem to exceed the average. If cancellations run high, then the hospital gets fined for not meeting targets, and that means less money for next...
We've had 6 operations cancelled this week. It's too many. Apparently, we could do better.
Well, the cancellations have already happened, so we'll just have to try harder next month.
Yes, but that won't have any effect on this month's figures, will it?
What are you saying, Tony?
Nothing.
Right.
The management expect a lower return on cancellations.
How much now?
Well, ideally, none.
Are you asking me to falsify the figures?
Did you telephone that patient who was on the waiting list?
She's back to Bangladesh from the 5th to the 19th of next month.
Book her into my clinic on the 8th. She won't be able to come, which means the delay in treatment will be patient-initiated, which means it doesn't count against me.
Right you are, Tony.
Actually, something we could probably, Excuse me, just a minute, Mr. Burns. Mr. Lake.
Sister.
Mr. Burns has come up from the hospital mortuary service. The bereavement midwife's off sick, so he wants to talk to the Taylors about the arrangements for their baby's funeral. I said it was something that we could do.
Yeah, okay. No problem.
Great. That's fine, Mr. Burns. We'll deal with it, thanks. Maybe we should come back later.
No problem. I'm nearly finished.
This is a difficult subject, but we have to talk about Daniel's funeral.
Okay.
You can make your own arrangements if you prefer. That's up to you. But the hospital does provide a funeral service. We arrange it through an undertaker. I'm sorry to mention money. Please don't be offended, but it is free. A coffin will be provided and he'll be buried near other babies.
There'll be a funeral service which you can attend, but he'll probably be buried in a multiple grave. You can pay for a separate grave and a headstone. The alternative is cremation, but it's unlikely there'll be any ashes for you to take home.
Why wouldn't there be any ashes?
I'm sorry, I don't know the reason why. We're just told to inform you of that. Sorry.
Okay, well, we'll think about it. Thanks.
Thank you.
Gyna, can I help you?
Mark Taylor, Karen Taylor's husband. Hi. No one fed my wife her breakfast.
Sorry, we're short-staffed today. Excuse me, sir. What do you think you're doing?
I'm looking for my wife's notes. We need them for the court case, the complaint, whatever it has to be.
You can't look at medical records without permission.
They're not here.
Sir, I've asked you nicely.
Where are my wife's notes? Excuse me.
I need to book an urgent ultrasound, please.
Are those my wife's notes? My wife's medical notes should be here.
Excuse me. Hi, I need to talk to someone about an urgent ultrasound.
ONG, straight away, thank you. You can't come in
I
here.
want to know where the hell are my wife's medical records.
I've called security. Someone's on his way up right now.
If they're not on the ward, where would they be?
It is not my responsibility to find your
What's
wife's
the matter
note.
with you? I'm asking you a simple question. What's the matter with you people?
Just calm down, sir.
All I'm trying to do is ask a question. Now, are you all so powerful and I'm such a piece of shit that I can't even ask a question?
I've called security.
What about you? Do you know what's happened to my wife's medical records?
I'm sorry, I don't.
You're all such patronising bastards. Do you know what happened this morning? My wife had her breakfast plunked down in front of her, and no one gave a shit that she couldn't feed herself.
Don't swear at me.
I'll swear at you if I bloody want to.
I'm calling security again.
Where are my wife's records? I'm sorry.
He was upset about his wife's notes and about her breakfast.
They are no excuse.
No, they're no excuse.
You were not on. I was, and I am reporting it.
I'm on now, and I'm asking you not to.
Is that how you look after the nurses on this ward, Donna? So who comes first, us or the patients?
All I'm asking is for you to show some compassion. By all accounts, he only pushed you.
Then do I have to bleed? I have to have broken bones or...
Everything all right?
Yes?
How's her blood pressure?
Blood pressure? Yes?
Everything's okay.
Everything okay.
I'd define her disease as moderate. There are 2 spots on... Where's he going now?
Fuck knows.
Go and find out what he's playing at, will you? I'd define her disease as moderate. There are 2 spots on the uterosacral ligament. Can you see those?
Yeah.
Everything all right, Dr.
Abiola. Abiola.
Everything all right?
I'm trying to buy a car that's already sold.
How long are you staying with us, Dr. Abiola?
I don't know.
Do you mind if I ask, where did you train?
Moscow.
Really?
Many, many students from Nigeria trained in Russia.
Have you always been a local?
Yeah. See, always a local.
Had the locum anaesthetist yet?
Say what you like about Maria. She was a decent guess, man. Some she's a bird, really. I'm afraid the new bloke is all yours, matey.
Who left these?
I don't know. Don't know.
Dear colleague, I'm writing to you to clarify a change of work status. The post of consultant anaesthetist will continue to be filled on a locum basis. Dr. Maria Orton, who is a valued colleague, remains indefinitely on psychiatric sick leave. Psychiatric?
About 18 months ago, she had a miscarriage. She became clinically depressed. They're saying psychiatric to make out it's a relapse. Bastards.
Grant this, O merciful Father, for the sake of Jesus Christ, our only Saviour, mediator, and advocate. Amen. Please accept my sincere condolences.
Thanks for coming.
That's okay.
We've got a solicitor now.
I hope they can help. I've got to get back to work.
She makes call after call to the hospital. No one ever gets back. And then finally, someone tells her they've lost the notes. They say they can't find them anywhere. The solicitor, she says, without the notes, it'll just take longer, years. I don't know if we can't be sure of winning. I don't know if I can give months, years to a legal battle. The money.
I'm sorry.
I'm a school teacher. If one of my colleagues can't control his class, doesn't prepare his lessons properly, then I know it. But if a surgeon hasn't done his job properly, how am I supposed to know? How am I qualified to know? Will you come and speak to our solicitor?
I can't.
Why not?
I'd lose my job. I can't. I'm sorry, Mark.
Why won't you help us?
A patient died because of a mistake that I made. Put me in the witness box. That's the type of doctor they're going to show me to be. I'm of no help to you. I'm sorry.
On with the show.
Hello. Don't worry.
Mrs. Drake, possible ectopic. Ultrasound shows a lot of free fluid in the pelvis. Probably significant internal hemorrhaging.
How long?
Plenty time.
We're ready. When will you be?
Soon.
This isn't a spinal. This is a GA.
Huh?
A GA. Lost half an hour dicking around with the GA.
So we lost half an hour. Just let me think. Retraction. More retraction. Thank you. Spencer Wells.
Boss. Boss?
Rob, will you shut up? I'm trying to think. Oh, shit. Getting that suction. Hold on there. Can you see it? I can't see it. Okay, let's clear the field so we can see the vessel. What's her blood pressure?
She's got it.
Huh? I don't understand a word you're saying. Would someone switch the music off, please? I think I've got it.
Yeah.
I've got it.
Good. Good work.
Boss, this isn't working. No, we should extend the incision, boss.
Well, will you shut up? Either do it my way or get out. Oh, shit. Suction. You're in my way.
Mr. Whitman, I need you to come to Theatre 12 right away, please.
I've got my own list here.
Mr. Whitman, please.
I'll be fine on my own for this first one.
Is Roger coming in?
I am.
I cannot take another consultant's case.
I've got a patient on the table in there. If Hurley carries on the way he's going, she's going to be dead in the next 10 minutes.
Patients die.
Not this one. She's an ectopic, she's bleeding heavily, she still stands a chance.
Really, Tony, I'll be fine.
Shit.
Oh, shit.
Rob here's not feeling very well, do you yourself?
Yeah, thanks, Tony. I might need you for a minute or two.
Let's have a look, shall we? She could be bleeding from the ovarian artery. What do you think? Plunk it twice, take it from there?
Yep. Thanks, Tony.
She's going to be fine, mate.
Which is more than I can say for you.
Mrs. Drake, how are you feeling?
Fine, thank you.
Good.
See? You did the right thing. Hurley was halfway to turfing her to the great outpatients department in the sky.
So it's good news for the patient, whoopee shit. What about me?
Strong, you know, upright, he's the boy. Of course, everybody knew it was his cock-up. I mean, the registrar came rushing in. I swear to you, if it hadn't have been for me... Hello, Rog.
I thought I was covering the labour ward today.
Yeah, we're just discussing a skaboo admission from yesterday. It's all yours. Oof. Imagine what she's going to be like when she's got a fanny like the Dartford Tunnel, eh?
Morning. Where's Donna?
Bay 2.
Could you take that for me, please, Kiki? Morning, Roger. How are you?
Well, thank you, Donna. To check to see how Mrs. Drake's doing.
Oh, the ectopic, yeah, sure. Can you pass me the word book?
Maya?
Are we a bit early, Roger? I'll just be 5 minutes.
Now, please.
Morning. Anyone in for the round yet?
You see, Mr. Lake, no one thought you were important enough to wait for.
You're late. Do we have her latest blood samples?
They must be in the trolley.
The other ward rounds claimed the trolley.
What other ward round?
day post-hysterectomy. She's complaining of little PV bleeding, but on examination it actually looks like it's PR. There's no chance we've nicked the bowels.
And we took her tonsils out while we were at it.
Sorry, I thought we'd timetabled our ward rounds so they wouldn't clash.
Got a very, very tricky day.
You sequestered the notes trolley.
Treasure trove. Now then, Louise, let's find out if you're bleeding for your back passage, shall we?
Well, everything looks good, Mrs. Drake. I just worried for a while. Glad to see you looking so much better.
Transfused overnight. She's doing well.
Good. Okay. Anyone else we should worry about?
No.
Good, thank you.
We've not really had a chance to talk about what happened in theatre.
It's not so long ago that you botched a crike and I had to cover for you.
You did, and I'm grateful.
Because I thought on this firm we looked out for each other. So what, you're going to management? You handed them one of those pissy yellow forms, yeah?
You're being paranoid.
No, you're being pronoid. You're suffering from the delusion that people are on your side.
Should let that woman die on the operating table. Been a lot less trouble.
I'm just checking your charts, Louise.
This is for my grandson. I've got 8 grandchildren. I had 7 children of my own.
It's good you had hysterectomy. Or your womb might have dropped out of its own accord. Louise Weezer, isn't she one of yours?
Yeah.
Have you seen her labs? This is Louise Weezer's results. It's her fecal occult blood.
Shit. Right, I'll talk to the colorectal surgeons. Oh, but she'll need prepping for a colonoscopy. I'm in a hurry.
Polly! Ah, Maya. Would you write up a new drugs chart for one of Polly's? Louise Weezer has just run out. She just needs bendrofluoride for her blood pressure. 2.5 milligrams OD. Polly wants Louise Weezer prepping for colonoscopy. She said it was urgent.
She'll need phosphate enemas then. Okay, Louise, now just relax, okay? It's all right.
Oh.
Donna.
Yeah, just a minute.
What the hell's going on?
She's having an enema before the colonoscopy.
She doesn't need an enema, just some Picolax sachets.
Kat said the colonoscopy was urgent. Urgent means to do an enema.
I never said it was urgent.
Kat said that you had said that you were in a hurry.
She thought I meant in a hurry to prep for the colonoscopy. Shit.
Well?
You keep stum. I'll clear it with the arsehole surgeons and see if they'll cover for us by doing the colonoscopy as urgent.
Okay.
Hi, Emery. Anything for me?
Yeah, these came from the unit administrator's office.
Dear colleague, reports have been received of golf balls being hit off the roof of the maternity unit. You are reminded that for health and safety reasons, the roof is out of bounds. If the culprit or culprits do not desist at once, disciplinary action should be taken.
The other's just to the consultants, a memo about the waiting list initiative.
Right, good. Thank you.
No patient can wait longer than 12 months for any operation of any type. I've done you and Tony lists of patients who are about to go over the deadline.
Thank you. Has Tony seen this?
I sent his over to colposcopy.
Thanks, Emery. How's it going, Tony?
Oh, you know, Rog. It's just vag after vag.
It's quite Have you seen the memo about this new waiting list initiative?
Skimmed it.
I've got one 12-monther on my list. You?
3.
Got to get them all in this week.
Haven't got the space.
We could try and make space.
Can't.
Why not?
Haven't got the space.
The unit administrator says she'll lose her job if we don't meet it.
The reason I've got those 3 women on a waiting list is because I don't think their problems are particularly urgent. Mick, why should I bust my bollocks so that some management prick can tick a box and then run off to a job at Bupa?
Thanks, Tony.
Candice.
What is it, Tony?
Bloody waiting lists.
Well, the management say you've got to sort it out, Tony.
Can't we, create an unpublished list and put my 12-monthers on there?
What shall I call it?
The, anticipated inpatient list.
No problem. Your waiting list problem is solved.
Jolly good.
Here we are, Louise, nearly back on the ward.
Donna, hi. Have you got a bed available for a waiting list patient?
No, sorry, Roger. No room at the inn. Nothing.
Polly, Louise Weezer has had her colonoscopy.
So report, sir?
Normal.
Good. Thanks.
I would be grateful if you would see this 39-year-old lady who presented to me in OPD with a red edematous tender vulva. I would be grateful for your dermatological opinion. Yours sincerely, etc., etc.
That was 2 I would be gratefuls.
Really?
Sorry, Tony. Is this another bad time? I was wondering, why don't you come round for dinner this week? Harriet and I have never had you and, You are married, aren't you, Tony?
I don't do dinner, Roger.
Look, I need a favour. One of your charges, Louise Weezer, she's 6 days post-hysterectomy. She had some PR bleeding. Polly turfed her over to the surgeons for a colonoscopy. She bounced back NAD. I'm just wondering if you could discharge her for me. I need the bed to get one of mine in off the waiting list. I've booked theatre time for tomorrow night.
Whatever.
Thanks, Tony.
Yeah, Louise. Still feeling a bit lightheaded. Okay, I'll say to the doctor and we'll come and check on you a little later, all right?
Well, they fixed this.
Donna, hi. Can we arrange to send Mrs. Weezer home tonight, please?
Oh, actually, she's complaining of drowsiness and lightheadedness.
Very lightheaded?
No.
Or very drowsy?
Well, no, I suppose not.
Well, she'll be more comfortable at home, and if she's still feeling under the weather, then she can ring her GP in the morning. That's what they're there for.
Doesn't she belong to Mr. Whitman?
Well, he said I could discharge her to make way for my waiting list patient, so can you send her home, please?
Look, I'm not being funny, Roger, but does anyone from Mr. Whitman's firm know that she's not feeling totally all right?
I don't want a falling out, Donna. I'd like her discharged, if you wouldn't mind.
No.
I'll do it myself, then.
Why didn't you back me up?
He's the consultant.
Mrs. Beeze's daughter.
Bay 2, second on the right.
Still feel a bit loose as show. I'm tired.
Come in.
Mr. Taylor's already arrived. Dr. Alton.
Thank you. Dr. Alton, Annette Prentice.
Pleased to meet you.
You remember Mark Taylor?
Mark.
Hi.
Please sit down. I know this is a distraction, but do you mind if I take notes?
No, not at all.
When we spoke on the telephone, you stated that you were present throughout the caesarean section to deliver baby Daniel Taylor and the subsequent hysterectomy on Karen Taylor.
I was the anaesthetist.
And in your view, Mr. Roger Hurley was negligent in his management of the case?
Patently negligent. He chose the wrong incision. He ruptured a plexus of uterine vessels and procrastinated over the hysterectomy.
And you would be prepared to testify in court to that effect?
Yes, I would.
Dr. Orton, I understand that you're not currently practicing as an anaesthetist.
I'm suspended.
On what grounds?
The hospital have yet to give grounds.
Dr. Orton, I'm sorry, but the hospital say you are not suspended. The reason they give for your absence is indefinite sick leave. I'm sorry, I'm not trying to embarrass you. It's just when I inquired, I received this letter in reply. It was sent to all the staff by the hospital administrator.
This is a lie. I'm excluded solely and absolutely because I tried to bring to their attention a catalogue of medical errors committed by Roger Hurley.
So you're saying you are not suffering from a psychiatric illness?
Most definitely.
Good. Now, I have to ask you this because it might come up in court. You've never suffered from a psychiatric illness. Dr. Orton, if this is difficult for you...
It is difficult for me. 18 months ago, I had a miscarriage. I was clinically depressed. I had to take time off work. But I got myself back together. And I did my job. I do my job well.
Thank you for your honesty. Thank you.
Hi, Rob. This is Maria Orton. I don't want to stay on this line for too long. Switchboard listening sometimes. I'm outside the hospital. Will you come and speak to me? Rob? Rob, can you hear me? Will you come and speak to me? I know you can back me up in my case against Hurley. If there are two of us with corroborating testimonies.
I'm sorry. I can't help you. I'm sorry.
Hurley is still putting patients' lives at risk. I can't believe you're saying this.
I can't back you up
Why not?
because it'd make me a whistleblower. There you go. Give it a 4. Cheers. What happened?
We got home all right, but then she threw up and had a fit.
Okay. I'm going to ask you to wait outside if you don't mind. I'm just going to do an examination. Thank you. Stay if you wouldn't mind. I might need to ask you a few questions. Louise and Mr. Lake, I need you to be nice and relaxed. We'll do a couple of little checks on you, okay? Good. Okay. One of the blood tests shows that the sodium level's very low. That'll explain the seizure. Is she on any other kind of medication?
Yeah.
I'll take a look.
These for blood pressure.
OK, the type of enema we've given her combined with these have probably caused low sodium. I'm going to stop these. I'm going to have her catheterised and put on restrictive fluids. I'll speak to the medical doctors, and if her sodium levels don't come up overnight, then I'll probably hand her over to them, OK?
It's probably just a little infection in your water. I'll talk to the doctors, see what they say.
We'll come and check on you later, OK?
Morning, Maya.
Good morning.
Louise Weezer was readmitted overnight. She now has a temperature of 37.5. She was catheterised, so it's probably a UTI. I've taken a CSU for her.
Oh, thanks. I'll get it off. Oh, I may as well write her up for an antibiotic now.
This is Lillian Edwards. She's for admission.
Does she belong to us?
She's been called in from the waiting list.
Oh,
You're whistling again, Lillian. You are whistling!
Look, I'll sort this out. We'll put you in the day room for now, Lillian, all right? Can you pop it in for me, please? Thanks.
Is my TCI in?
Lillian Edwards? I don't have a bed for her.
But I had Louise Weezer discharged last night to create a bed.
Yeah, the patient bounced.
Oh.
Oh.
Have you got any other TCIs today?
There's a lady coming in for a prolapse repair.
Okay, phone her, cancel her, and give her bed to Mrs. Edwards.
The prolapse has been waiting 11 months.
Donna, please, cancel her.
So, Roger, if I cancel her operation, it's not long before she's at the 12-month deadline.
Well, it's a month.
So what do they want us to do then?
Well, that's next month.
But if every month you keep having to cancel one lot of patients to bring another lot in, then you're never going to... Sorry. What was I thinking of?
Mrs. Drake, HB Holding, no problems.
Good. Excellent. Home, then. I should take an early look to ensure that everything remains well. We can do that as a day case. Someone go and see what she wants. Rob? We'll be all right with that, are you?
I gave Louise her first dose of penicillin. I think she's having a reaction.
Yeah, that's a reaction. Forget about that.
Should we lay her flat?
Leave it to me. Get me the adrenaline. 1 mil of 1 in 1,000. 200 of hydrocortisone. 10 of chlorpheniramine. 5 milligrams of salbutamol to be nebulized. And gelifusing on standby. Louise, you're going to be fine. This type of thing happens all the time.
Isn't this the lady I had discharged?
Yeah. Shit.
Okay, someone get me an ambu bag and a Goodell airway right away. Put out a 2222 respiratory arrest. She needs to be intubated.
Do you want to do it? Still got a pulse. Ish.
Still got an output.
The anaesthetist being fast bleeding.
I'll back her while you set up to intubate.
Okay, so we'll get the jello running, please.
Yep.
Well, what's happened?
No idea.
Maya?
Not sure.
No output. Start compression time.
Okay, get me an adrenaline shot. Where's the anaesthetist? Cat?
I'll get...
Bring her notes.
okay. I'm going to try intubating her before the laryngeal edema gets any worse. She's too swollen. Maya, stop for a second. Maybe I could... Shit, no. I need a narrower tube.
Donna, get onto the theatre, get a narrower tube. Where's that bloody anaesthetist?
What do you prescribe her?
Amoxicillin, 500 milligrams IV.
She must be allergic to penicillin.
I don't know.
Chest compressions. Chest compressions.
What are you doing in there? It's this one. For sake.
I don't know.
Just standing outside.
I'm sorry, but I went to the wrong ward. I'm still new.
Come on.
Maybe we should try shocking her.
It's not part of the assisted protocol. Tube.
Not going to make much difference.
Any idea what happened?
Thank you.
No.
Just stop for a moment, man. Oh, shit.
She's not breathing on her own.
Shit.
What's happening now?
She's still not breathing for herself. They're ventilating her and they're going to take her down to ITU. You admitted it to anyone yet?
No.
Written up any notes?
Mm-mm.
Keep it to yourself. I'm going to buff the notes.
Rob.
Someone should have realised before a prescription was carried out. It's not just your fault. Christ almighty. She should never have been discharged last night. We would have picked up on the low sodium and she'd be home by now watching telly with a cup of tea.
If it isn't my fault, whose is it?
Give me a bleep and go home.
What about work?
It'll be fine. Especially now we've got one less patient to worry about. Give me a bleep.
Fill out a clinical incident form.
Must be joking. Look at the state of her. But do you want to own up to that?
Christ, no.
What's she in for, anyway?
Hysterectomy.
Jesus Christ. Don't you just love hospitals? Comes in to get her dry old bits lopped out. After all the cock-ups, it's a UTI that does her.
From UTI to ITU. Palindromic referral.
ITU. They used to call it intensive care. So they realised nobody did.
Have you
you off the notes?
Elongated entry by anaphylactic shock, severe laryngeal edema, every bit of bad luck during the resuscitation, our heroic efforts. Not so much about the fact she was given the wrong bloody antibiotic.
Relatives next.
I can talk to her if you want. I've spoken to her before.
Okay.
This is the consultant, Mr. Hurley.
Hi. Thank you for coming in so quickly. I'm really very sorry about what's happened.
Your mum develops an infection in her water. This often happens when a patient's been catheterised. It was absolutely essential that we gave her the strongest antibiotic available. For some reason that we're still investigating, her allergy to penicillin was not recorded on the drug chart.
But why didn't anyone know about our mum being allergic to penicillin?
Well, we've started an urgent investigation. It may be that your mum forgot to mention her allergy, or that it wasn't recorded by the doctor that admitted her for the hysterectomy, or that the pharmacist didn't label her drug chart. There are so many steps involved with something as simple as giving a patient the medication. It's just too early to decide what precisely went wrong. Needless to say, as soon as we've got more of an idea, we'll be completely open about it with you.
Was this something what wouldn't have happened if she hadn't been sent home?
She would have needed the antibiotics anyway.
Can we see her at all? I'll phone the ITU and find out when would be a good time for you. Thanks.
I'm really very sorry.
Thanks.
What a total sodding balls up.
Should be a couple of minutes.
Okay.
So, we're entitled to an explanation.
That woman, you get involved in her discharge, the next thing she ends up in a cabbage patch.
You know how much pressure I was under to get that patient in off my waiting list?
Oh, yeah, that's right. This is also that you get to fix some old dear's vag, not that she actually uses it anymore. Tell you one thing, Rog. She will not appear in my figures. No bloody way.